More than half of all glaucoma cases remain undiagnosed because patients show absolutely no symptoms until their vision loss is already permanent. Right now, millions of Americans are going blind, quietly, painlessly, with no warning whatsoever. And the most terrifying part, by the time they notice something is wrong, up to 40% of their vision is already gone forever. Today I am going to show you exactly what glaucoma is, why doctors call it the silent thief of sight, the 6 warning signs most people never connect to their eyes, and the one test that can catch it before the damage becomes permanent. Sign number 4 is something that happens to millions of people every single night, and every one of them has a different explanation for it. They are all wrong. Glaucoma occurs when increased pressure builds up inside the eye, silently damaging the optic nerve, the cable that carries everything you see directly to your brain. If left untreated, it causes partial vision loss and then complete, permanent blindness. Around 4.22 million people in the United States have glaucoma right now, and nearly half are completely unaware of their condition. More than 120,000 Americans are already blind from glaucoma, and it accounts for 9 to 12% of all blindness cases in the country. Here is what makes glaucoma uniquely terrifying. Open-angle glaucoma, the most common form, has absolutely no warning signs before vision is noticeably affected. This painless condition typically begins with the loss of peripheral vision, making it nearly impossible for patients to detect changes until the condition has significantly advanced. Your central vision stays sharp. You can read, you can drive, you can watch television, all while the edges of your world, your peripheral vision, are being erased. Slowly, silently, one nerve fiber at a time. And those nerve fibers never grow back. The damage is permanent. Here are the 6 warning signs most people miss completely. Warning sign number 1, you are bumping into things at the edges of your vision. Not dramatically, just small things. A door frame you clipped. A glass you knocked over reaching from the side. A person who seemed to appear out of nowhere. You blamed it on clumsiness or distraction. But this is peripheral vision quietly disappearing, and it is one of the earliest signs glaucoma has already advanced significantly. Warning sign number 2, halos around lights, especially at night. You are driving at night and the oncoming headlights have bright colored rings around them. Street lights look like they have a glow or halo. You assumed it was your glasses or tired eyes. These halos are caused by increased fluid pressure inside the eye distorting the way light enters and hits your retina, a classic early warning sign of glaucoma that most people dismiss for years. Warning sign number 3, frequent headaches centered around your eyes or forehead. When eye pressure rises even slightly, it creates a dull, persistent ache behind the eyes or across the forehead. This is not a tension headache. It does not respond fully to painkillers. It returns. Most people treat this as stress or screen fatigue for years, while their optic nerve silently deteriorates behind it. Warning sign number 4, difficulty adjusting from light to dark environments. You walk into a dim restaurant from bright sunlight, and it takes much longer than it used to for your eyes to adjust. You go from a lit room to a dark hallway and you are essentially blind for an uncomfortable amount of time. Glaucoma damages the cells in the retina that are responsible for vision in low-light conditions first, long before central daytime vision is affected. Most people blame this on aging. It is their optic nerve. Warning sign number 5, sudden eye pain, redness, and nausea. This is the warning sign of a different and more aggressive form called acute angle closure glaucoma. While most glaucoma develops silently, acute angle closure glaucoma can sometimes strike suddenly, causing intense eye pain, redness, blurred vision, headache, nausea, and vomiting. This is a medical emergency. The pressure inside the eye spikes dramatically within hours, and if not treated within 24 hours, permanent blindness can result. If you experience sudden severe eye pain combined with nausea and blurred vision, go to an emergency room immediately. Warning sign number 6, a family member has been diagnosed with glaucoma. This one is not a symptom, it is a risk factor so powerful it functions as a warning. Glaucoma is most common among people over 60, those with a family history of the disease, and people who have diabetes. If a parent or sibling has glaucoma, your risk of developing it is 4 to 9 times higher than average. If you have a family history and have never had a comprehensive eye exam, you are gambling with your sight right now. Now, the one test that catches glaucoma before damage becomes permanent. It is called a comprehensive dilated eye exam, and it is completely painless. An ophthalmologist dilates your pupils with eye drops, then examines the optic nerve directly for signs of damage and measures the pressure inside your eye. If diagnosed early, appropriate treatment can help slow or even prevent further vision loss completely. Eye drops, laser therapy, surgery, all highly effective when glaucoma is caught early. The tragedy is not that glaucoma cannot be treated. The tragedy is that most people find out too late. Population-based studies suggest that over half of all glaucoma cases in the United States remain undiagnosed. Over half. Right now, losing their sight one silent day at a time. If this video helped you, share it immediately with someone over 50 in your life, or anyone with diabetes, or anyone with a family history of glaucoma, because they may be losing their sight right now and have absolutely no idea. Subscribe and hit the bell, because in my next video I am going to to reveal the disease that is silently destroying the nerves in millions of bodies right now, causing pain, numbness, and weakness that doctors misdiagnose for years, and most people are living with it undetected for decades before they get an answer.